People with diabetes are twice as likely to suffer from depression as people who don't have diabetes, and conversely, people who have depression are more likely to develop diabetes than people who don't have depression. If they're depressed, for example, they may not have the levels of motivation or concentration that are required to make the lifestyle changes that they need to make, and as a result their diabetes gets worse. They can develop diabetes-specific psychological problems such as fear of needles, fear of having hypoglycemic episodes. We also know that when people have diabetes and depression together, they have worse outcomes. They have increased rates of complications and their mortality rates are higher. And that's why here at King's there's a very strong emphasis on managing mental health problems that present with diabetes to provide the best possible outcomes for our patients.
Consultant that works with Dr. Anne.
It's gonna help. And then when I went back and she put my talk to me about my mom, she died when she was 50 with diabetes. It gave her kidney failure and she died. My uncle, he died when he was 46 with diabetes. Diabetes doesn't kill you, it's the effect that damage you. He went blind and kidney failure as well. Last year I was saying to Dr. Andarati that my aunt is sick in Jamaica and I don't want her to die, but she died in November with diabetes as well.
If we can clear up some of the social support issues that are worrying them and causing them stress from day to day, and certainly getting in the way of them managing their diabetes, then I think that means that their minds are kind of free to address their diabetes.
Every week we meet and we go through the referrals and we decide who would be the best person to assess this patient. If there's predominantly social problems, obviously maybe one of the support workers will see them. And based on that, we decide what care the person needs in conjunction with the patient themselves. We have demonstrated that our patients on average have improved their diabetes control. We have recorded improvements in HbA1c, which is our measure of diabetes control, of 1.6% or 16 millimoles per mole, which is very significant. We're very pleased to be part of a service that is so groundbreaking in its innovation and in its integration of mental, physical and social support all in one team, integrating various services that normally wouldn't be together and providing true parity of esteem for our patients. I know that this is a priority for the Mental Health Task Force, which is out now, and we're very pleased that this is something that's going to be taken up in other areas.